Good morning, this is Dr. Deepa from Department of General Pathology, SRM Dental College, Ramapuram. In the previous sessions, we saw how the tumor spread, that is both local invasion as well as metastasis. Under metastasis, we saw it spread through lymphatic permeation, hematogenous spread, and spread along the body cavities. Now let us see how the tumor cells invade the blood vessels and cause metastasis. The invasion of tumor cell is divided into a number of steps under molecular level. So under that comes the first level, that is aggressive clonal proliferation and angiogenesis. So the fundamental abnormality resulting in development of cancer is the unregulated proliferation of cancer cells. Rather than responding to the signals that controls normal cell behavior, cancer cells, what they do is they grow and divide in an uncontrolled manner, and then they invade the normal tissue and organ and eventually spread throughout the body. This is the clonal proliferation of cancer cell. Coming to angiogenesis. Angiogenesis is an important factor in progression of cancer. It is a physiological process through which new blood vessels form from the pre-existing blood vessels. Following proliferation of cell, the next step that is involved is the tumor cell loosening. This is carried out by the cell adhesion molecule, which is the CAMs. These are the subset of cell adhesion proteins which are located on the cell surface, and this is involved in binding with other cells or with the extracellular matrix, that is the ECM, and the process is called cell adhesion. And the E-catherines, these are known as the epithelial catherines. These are on the surface of one cells and can bind with those of the same kind on the other cells to form bridge. And the loss of this cell molecule usually is involved in the formation of epithelial type of cancer, which is called as carcinomas. Next step is the tumor cell ECM interaction, which is the extracellular matrix interaction. Here, as you can see in the picture, the cancer cells are loosened. So these loosened cancer cells are now attached to the extracellular matrix proteins, mainly the laminin and the fibronectin. Then the next step is the degradation of extracellular matrix. So these cells, that is tumor cells, what they do next is they overexpress the protease and the matrix degrading enzymes. By doing this, what they do is they will degrade the extracellular matrix, and then they will cause dissolution of the extracellular matrix, first of the basement membrane and then also the endothelial lining of the blood vessels. Then they enter into the lumen. You can see in the picture how they break down the endothelial lining and they are entering into the lumen. The tumor cells, after degrading the basement membrane, are ready to migrate into the lumen of capillaries and venules. You can see in the picture how the tumor cells have degraded the extracellular matrix and they have entered into the lumen of the blood vessels. Once the tumor cells have entered into the lumen of the capillary, now they are covered with the constituents of circulating blood, which helps in the formation of thrombus. This thrombus provides nourishment for the tumor cells to further proliferate. Next step is the extravasation of the tumor cells. Now that the tumor cells have entered into the circulation, that is the capillaries, venules or lymphatics, they will mechanically block these vascular channels and then they will attach to the vascular endothelium. In the diagram, you can see how the tumor cells have moved to the opposite side of the blood vessels. That is, the same sequence will repeat. The tumor cells will first degrade the extracellular matrix and they will exit outside the blood vessels. Survival and growth of the metastatic deposit. The extravasated malignant cells on lodgement in the right environment will start growing further. That is, they have moved out of the blood vessels and they come out of the blood vessels into the extravascular space. From there, they will find a right environment where they get sufficient amount of blood and nutrients, and they will start multiplying. That is, they'll start proliferating, and from there they may further spread to different location, hence spreading the cancer throughout the body. So this exactly is the mechanism how the tumor enters into the blood vessels and comes out of the blood vessels after falling through these various steps of proliferation and angiogenesis. With this, I come to conclusion of this spread of tumors and also the invasion of tumor cells. Thank you.